Well, on today's episode of America's Healthcare System is Completely Fucked, I have health insurance. But I didn't have health insurance last year when I got my moles removed from my back and it came back cancerous. So I got health insurance because that was $1,600. So I got health insurance in January. I pay $350 a month. I go to my dermatologist appointment that I've already been to. And they say that they cannot take my insurance unless I have a referral from my primary care doctor, which I don't have a primary care doctor at the moment because people usually aren't taking new patients. So I need to find a primary care doctor that takes my insurance, go to them, make an appointment, and then they have to refer me back to the place right behind me in order to take the rest of my moles off that probably have cancer. Because I couldn't pay out of pocket. Because they said, you could pay out of pocket today, but then we wouldn't be able to take your insurance next time you come back. What the fuck does that mean? Like, what the fuck is wrong with you people? And by you people, I mean these healthcare system. Who sets this shit up? You guys are fucking morons. I hate every single one of you who decides this stupid, random-ass bullshit jumping through hoops to get healthcare. Fuck you. Fuck you. And also, while we're on the fucking subject of how insurance is such a goddamn fucking scam, car insurance? Fuck you too, bitches. Because I have never been in an accident, knock on wood, and yet, my fucking full coverage every month is over $200. I tried to switch because I was like, this is ridiculous, I shouldn't be paying this much money. And they go, oh, I see that you have 4 incident reports, so like your premium will be $186 a month. And I'm like, what are you talking about? I've never been in an accident. And they're like, oh, you got your windshield replaced. Because I have full coverage. And I pay for full coverage. So when I crack my windshield on the fucking freeway, when a fucking rock hits it, and you take care of it, you're telling me that's penalized against myself? So that, what? Like, I fucking hate you guys. I hate every single one of you with a burning passion of hell. I hope every day you wake up with a splinter in between your toes. I cannot stand you. I hope your fucking tires get slashed every Tuesday. You lose the TV remote every single day. Fuck you.
Health insurance is a fucking scam because, like, what are premiums for? Honestly. I pay $600 a month for funsies because I still have to meet my deductible. You would think, realistically, that premium would go towards your deductible, but no, I have to pay monthly premium just to have it. And then I have to meet this thousands and thousands of deductible for insurance to only cover a percentage. And I swear, health insurance con artists are getting even more clever because I feel like every time I go to a doctor's appointment, dentist appointment, I pick up a prescription at the pharmacy, the amount I'm charged is always different every single time. And of course, I contact the doctor's office or whatever when I get like an outrageous bill in the mail, and I question like, why is this amount? I've been charged X amount of dollars for this service, and now it's like double what it normally is. And they're like, I don't know, you need to contact your insurance. And then I finally get the energy to call my insurance, and I get transferred to about 10 different people, and I finally speak to someone. They're like, oh yeah, it should have been this amount. My daughter saw her neurologist that she was referred to for the first time in December. I'm just now getting all these statements about it, and under my plan, a specialist copay should be $60 and a primary care doctor should be $40. In December, I already had met my deductible. I had my baby earlier that year in July. My daughter had a hospitalization. I had a hospitalization due to my preeclampsia, so I know for sure that my deductible had been met. They're over here charging me $355.86 for an office visit. They charged me, I don't know, $200 just to send her EEG to Cook's Children's just so somebody can read it. I've already paid for the EEG at the hospital that she actually got the service at. And the guy at the insurance, he actually seemed like a swell guy. He was like, yeah, that doesn't sound right. I would just ignore all claims right now and we'll investigate this further. The fact that they know that most people wouldn't have the energy or the time to jump through all these hoops to make sure that you're being charged the correct amount is literally insane. And they know this and they profit off of that. You have to double and triple check your amounts. Always ask for an itemized bill. every single time because they are probably charging you for services that you didn't even receive. And most people don't have the energy to question this. But in this day and age, in this economy, we're at a point that every single penny counts. Always question every charge, every service, because at this point, they are drawing random numbers out of a hat, and you can't convince me otherwise.
I want to start by saying I do not in any way, shape, or form support violence, period. I do, however, very much support the discourse going on online right now about private insurance companies and how they prey on the sick and the weak to turn a profit. I'm someone with an autoimmune disease. I have ulcerative colitis. I got diagnosed when I was 8 years old. And so I have ample experience with how sick and twisted these companies can be. When I turned 26 and had to get off of my parents' beautiful, gorgeous state insurance, I had to get a high deductible plan. It was the only thing my job offered me at the time. And let me tell you, I was paying $200 a month to just have coverage, and then was paying an additional $500 for the 2 prescriptions that I take on a daily basis. 2 prescriptions that I medically need to be alive, costing me $500 per month. Sure, no problem, while still paying $200 a month for health insurance coverage. High deductible plans are criminal and absolutely horrible for anybody who has any type of condition at all. And now, thank you, Jesus, Mary, and Joseph, have a new job with different insurance, and I only pay $20 per month for those same prescriptions, which should give you some perspective on how insane it is that it's that big of a difference. But now on my current insurance, I, this year, had to spend $1,000 on a colonoscopy. I get colonoscopies biannually. It comes with the territory. I used to have to get them annually. There might be a time where I have to go back to getting them annually. It all depends on the progression of the disease. And when I tell you, when I scheduled the colonoscopy, the first thing I did was call my insurance and say, hey, what the hell am I going to owe for this procedure? And wouldn't you know it, no one could give me a straight answer. It could be anywhere between $90 to $1,000. Well, we're not sure. It's hard because you're so young. If you were 45, we could cover it for free. But you're not, so you have to pay. And let me explain to you how particularly insane that is. The reason that colonoscopies are covered for individuals 45 and up is because it's to screen them for colon cancer. When my likelihood of getting colon cancer is like 60% higher than the average American because of my condition. But you're gonna cover the scope for them at 100%, no questions asked, but not me. That's crazy. And when my insurance couldn't give me a clear answer of what the service would cost me, I then had to do a 3-week goose chase with every individual in the billing department at the hospital system that I'm a patient at to try and get a clear answer. And I still couldn't get one. Eventually someone said to me, you just gotta come do the procedure and see what you get billed after. Like, imagine if any other business operated that way. Hey, yeah, like, come buy this thing and, like, you won't know what you'll owe. Hopefully you can afford it. So that's what I had to do. That's literally what I had to do. I did the procedure, waited a month, I got my bill in the mail, and wouldn't you know it, it was $980. So I filed an appeal, waited another month just to get a letter in the mail saying, sorry, you're on the hook for all of it. And, like, I will recognize my level of privilege and say that I'm grateful I'm able to pay that bill and not have it really impact my day-to-day life. But I still shouldn't have to, as a young person trying to save money like everyone else. And I also am disgusted at the fact that there are likely hundreds of thousands of Americans who would have to go into debt to pay that bill, or worse, would potentially not get the procedure or the care they need to avoid paying that bill. It's sickening.
My health insurance is $450 a month. Last year, it was $20 a month. And since transferring over to this new health insurance plan, which obviously this one now is because I am self-employed, which, hell yeah, I love being self-employed. But $450 a month for health insurance? Okay, so I got that amount and I was like, all right, whatever. Like, I have cystic fibrosis. I got to do what I have to do to have health insurance because I have to see my CF doctor every 3 months. And I'm also on medication that is technically $300,000 a year for 2 pills a day. But the other day I went to the doctor's, right? And do you know how much my copay was? $400. And you want to know what else? I ordered one of my medications. My copay? $2,500. Yeah. So now, I especially see why people try to heal themselves naturally. I don't know how people fucking do it. And before you guys come in the comments and say, well, you know, if you worked at a regular 9-to-5 job, like, you would get health insurance covered. I already know that. But I still feel like there are so many more perks to me being a business owner. And honestly, I don't even think it's the cost that fucking eats me up. It's the fact that you go to the doctors and then they still can't even tell you what's wrong with you. Okay? They can't even tell me how to balance out my fucking hormones. The only doctor that I have that is worth me going to is my cystic fibrosis doctor. Because they actually take care of me and can figure out what is wrong. So I'm determined to heal all of my problems the natural way with supplements and healthy food and taking care of myself. Because also if I worked a regular job, my CF doctor is only like covered by certain insurance. So the job that I would end up working probably wouldn't even cover my CF doctor anyway, or my crazy medications that I have to be on for my CF. The real scam in this lifetime is healthcare. Like a year and a half, 2 years ago, I had extreme bloating issues. I all of a sudden went from a 00 to like a size 8, which there's nothing wrong with being a size 8, but there is when you jump 8 pant sizes within a couple of weeks. When I did not change anything in my life, I wasn't eating more, I wasn't excessively drinking, and I was talking to the doctors about this and was trying to like figure out what was wrong with me, and they're like, no, you're fine. They just do like this basic blood test and they are like, nope, nothing's wrong, you're crazy. They literally told me, no, you're just like getting to that age where now you just gained weight, like maybe your metabolism is not what it was. I'm like, this happens in 2 weeks? What? Ended up doing a shit ton of research on gut issues and all of that. And not only did I completely stop my bloating and now I barely ever bloat, but I also don't even need to take my digestive enzymes anymore for my pancreas because of my cystic fibrosis due to whatever it is that I did. My CF doctors were literally like, you're pancreatic sufficient now. So healthcare's a scam and they just want our fucking money.
Does anyone else's work do this, or do I just work for a terrible company? I have my health insurance through my work, and my husband is also on the plan. And because of that, and the fact that he can get insurance through his own work, they charge me $100 a month on top of, the premium cost. And that is now going to go up to $150 a month. And I just think this is ridiculous. He doesn't have the insurance through his work because he works for a small business, so the cost is a lot higher. So I guess we're saving money there, but it's just wild to me that we have to pay for the premium and now this monthly charge, and it's a high deductible plan. So really they're not paying anything out, that we're not meeting a deductible ever. So what's the point of having health insurance at this point? And I also work for the company that my insurance is under. So what's the benefit of anything? Does anyone else's business or company do this? Have them have a fee each month for being on the company insurance?
You need to buy medical insurance. Why? I'm healthy. Because if something happens to you, you'll have to spend thousands of dollars. But the insurance is thousands of dollars. Trust us, it's worth it if something happens. Okay, something happened. Can you pay? No. You need to spend $20,000 first.
Being a small business owner comes with a lot of perks, but there's a lot of negatives, and today is one of the negative. I'm feeling very negative about being a small business owner is the healthcare. Now, granted, maybe I don't have the best healthcare, and there's better healthcare out there, but last year, out of sight, out of mind, I forgot to do a renewal on my plan, and so they auto default me to another plan, which is more expensive. It's a mess. I deeply hate the whole healthcare insurance. It's all bullshit, right? It's just a bunch of bullshit. So I pay roughly $800 a month for me and my husband. We each have like a $12,000 deductible, and we have all these copays. I'm incredibly tired. So I went to the doctor because I want to get a sleep study done to see what's going on. So I wanted to go to the actual place to do a sleep study. I just get a voicemail saying that they had to cancel my appointment. I scheduled this appointment months ago. They canceled it because the insurance will not approve an in-house study, only a home study. So I got to call them, the doctor, to reschedule to do the whole in-home thing. Is it better just to not have insurance, and when something happens, you just figure it out then? Is that the best way to go about this? Because I'm paying $800 a month anyways. Then if there's a major medical, there's an issue, I'm still going to have to pay $12,000 out of pocket. Then we have all these other copays. Just make it make sense to me. I don't freaking understand this. And I hate that I'm even on here complaining, but I figured the best place to complain about this is on TikTok, because I'm not going to do it on my other social medias. But I just don't understand it. And I don't want to do a sleep study at home. I don't know how to hook up the machines. That's the reason why I have healthcare. And so the trained professionals can hook up everything and do it themselves. Like, what if I do it wrong? I am not a medical professional. I don't know. I'm just upset and I don't understand it. It's like, I don't know if that's the reason why I want to get the sleep study. Do I have sleep apnea? Is something going on when I'm sleeping? Or is it the fact that my husband rotates around like a rotisserie chicken all night and wants to hold me and hug me and maybe disrupts my sleep? Or is it the fact that my legs hurt all night and they're always cramping and I feel like I have like little creepies crawling all over my legs and I'm continuously moving? I don't know. That's why I wanted to go to a place to get it looked at. It's just stupid.
Do you guys know about what an allowed amount is in insurance when it comes to codes? I've been crying because I found this really great therapist, and yeah, she's at a network, like most of them are. And I'm gonna be honest, I pay $450 a month for insurance. My out of network deductible is $1,000. Okay, so I'm under the impression that once I pay $1,000 out of network, right? This is what it sounds like. Then I will start getting reimbursed. What they said would be 70%. None of this is true. So basically, I submitted the claims for $250 a session, which, like, she's great. She deserves to get paid. This isn't an issue with her. Again, yeah, I don't think that she should be getting paid less. I just think that this should be more accessible. So I submit these claims for, $250 each, and I get an explanation of benefits, and I'm like looking at my deductible, and I'm like, great, this is going to go up in 4 sessions, right? Like $250 times 4, $1,000. By then I'm going to be getting 70% of that $250 reimbursed. Not what's going to happen. I look at my deductible and it goes up like $200. I submitted $500. So I called my insurance and I was like, what's up with that? And they were like, well, the billing code for that particular type of service is coming up as the allowed amount for that service is $101.24. So they're only going to cover $101 of this, but they're not even covering it. They're just counting that towards my deductible. So not only am I not getting the full amount that I paid out of pocket for this thing counted as a deductible, they're only saying, well, we'll only count a percentage, not even a percentage, just the steady amount that we think that that service is worth. So they think that that service is only worth $101. So they will only count 101 towards my deductible, meaning instead of 4 sessions, I need to do 10 sessions to hit $1,000, which is $2,500 later. So $2,500 later, you think that I'm like, okay, so I hit my deductible. So now they're going to cover 70% of this $250. Wrong. They're only going to cover 70% of the 101 because they still don't see that service as worth the amount that the person bills for. Only this, like, I don't want to say arbitrary, but it feels fucking arbitrary amount of 101 that they think is, what it's worth. And they're only going to give me, basically, I'm just going to get $70. And that's after I spend $2,500. I'll get $70 per session. And I'm just like, fine, I should just fucking quit. I should just not go. Like, why? I don't have money like that. I already pay $450 a fucking month for this health insurance. And I know you could say, well, find someone in network. Do you think I fucking haven't tried that yet? I've tried so hard. I've been trying to find, I did have a really great one. I really need to work on my OCD. I really need someone that can help me with that. And I haven't been able to find someone to help me with that is in network. Found this person. She's amazing. I already feel like it's helping. I trust her. I want to keep working with her. She deserves to get paid. I deserve this sort of care. But I was completely misled. I don't even know why I spend this much on health insurance. I should just fucking pay the bare minimum because it's like, it's all a lie. It's all a scam. All of it is a fucking scam.
Here's why I believe health insurance in America is a total scam. Okay, so I had my first son in June of 2021. To be exact, and this is going to matter, it was June 30th, 2021. We still have Blue Cross Blue Shield insurance, and it was supposed to cover a lot of things. It was going to be really good for, the whole labor experience. So I ended up in emergency C-section. And so of course, there's a lot of bills. If you don't know, if you're not familiar with the way America does things, you get charged for absolutely everything that happens. Every time they walk in your room or look at you is a charge, essentially. Wasn't too concerned. I have health insurance, so not a big deal, right? Well, I ended up, after I had my son, it looked like everything was going well, and then they contacted me and let me know that my insurance actually, for some reason, just stopped. My coverage ended on June 29th. Just happened to be a random day, the day before I had my first son. So we fought it, and I was like, that doesn't make any sense. I even told them that I know they're doing this intentionally because I asked what would be the reason for my insurance to end. We paid for that month, what would be the reason? Nobody could give any sort of reason. Anyway, for that one, they just kind of, eventually we talked to the right person. They were sending us back and forth, the Marketplace, back to Blue Cross Blue Shield, sending us back and forth. Eventually, they covered it. I mean, mostly, of course, there's always things that they don't cover. And actually, there were some things that they didn't cover that we thought that they did, that we found out later. But anyway, they did better than what they said they were going to do. Well, with my second son, he was born on October 9th of last year. And so he's turning 1 next month. Well, several months after I had him, our doctor's office contacted us and said, hey, your insurance is now saying they're not going to cover it. So they already did. They already paid. But we're actually going to have to refund them. And then you're going to owe us this money. I'm like, well, that doesn't make any sense. So let me see. Turns out the coverage ended yet again the day before I had my second son, even though we paid for our insurance. A good amount. We pay a good amount for our insurance. So we contact them. They're like, yeah, it looks like you should have had coverage. I have no idea. I'm like, well, not going to work. I'm not going to pay it. I'm sorry. Just plain and simple, I'm not paying it. Well, we're still fighting it. They didn't bill us for a long time. So my husband and I are like, maybe they were confused. Maybe they did cover it. We're hoping for the best. Until we got an alert one day that we had been now billed $13,000. And I'm sure there's more to come. So you pay monthly for insurance that essentially just decides that they don't want to do anything. And then you pay more for your medical bills. So Blue Cross Blue Shield, if anybody from there is watching this, do the right thing and stop trying to scam people because it's really frustrating and I'm not paying it. I'm just straight up it's not going to get paid from me because I pay for my insurance, which was supposed to pay for it. So figure it out, please. If you have a wild story about insurance, let me know in the comments. It's frustrating.